Alright, so today we will be discussing bronchodilators, the topic of veterinary respiratory pharmacology and veterinary pharmacology. Alright, so these are drugs which causes an increase in the caliber of bronchus and bronchial tube. Okay, so bronchodilator, as we can see, these are made up of two words, broncho and dilators. Broncho means bronchus, and or in general terms bronchial tree, respiratory tree, and then we have dilator. Dilator, that is to increase the diameter or caliber. Okay, so these are the drugs which causes an increase in the caliber of bronchus and bronchial tree. Very easy. So now we'll be discussing the classification of bronchodilators. So talk about the classification of bronchodilators, and bronchodilators can be divided into four categories. Okay, so adrenergic agonists or sympathomimetics, muscarinic receptor or anticholinergic, muscarinic receptor antagonist or anticholinergic, methylxanthine and leukotriene antagonist. Okay, now adrenergic agonists or sympathomimetics. So why are we calling adrenergic agonists as sympathomimetics? Sympathomimetics means this is made of two terms. This is actually a topic of ANS, but we will discuss it right here also. Sympatho means sympathetic nervous system, and this mimetic means to mimic, to copy. So sympathomimetic. Okay. So adrenergic agonist, adrenergic obviously belongs to sympathetic nervous system. So adrenaline is secreted. That is why it belongs to adrenergic or sympathetic nervous system. So adrenergic agonist or sympathomimetics. Okay. Okay, so these are the same drug because adrenergic agonist means sympathomimetic. That is the drug which will mimic the function of natural the adrenaline, which will bind to specific adrenergic receptor. Okay, so these are the drugs which will mimic the function of sympathetic nervous system. Okay, so there are two subcategories within adrenergic agonist or sympathomimetics, that is non-selective beta receptor agonist and selective beta 2 receptor agonist. Okay, all right. Non-selective beta receptor, you have epinephrine, ephedrine, isoprenaline, orsiprenylene. Then selective beta 2 receptor agonist, you have clenbuterol, terbutaline, salbutamol, and salmeterol. So why are we talking about here specific beta 2, not beta 1 or okay, or beta 3? So we are talking about here with respect to beta 2 only, because beta 2 is responsible for smooth muscle relaxation. Okay, that is the thing. Okay, so clenbuterol, terbutaline, salbutamol, salmeterol, these are the examples. Okay, okay. Then we have a muscarinic receptor antagonist. So muscarinic receptor antagonist is also called anticholinergic. Very easy. Muscarinic receptor, that is parasympathetic, and anticholinergic, that is these are antagonists. So anticholinergic opposite to the effect of acetylcholine. Okay. So drugs are atropine, glycopyrronium, ipratropium. Then we have got tiotropium and eukotropine. So atropine, glycopyrronium, ipratropium, tiotropium, and eukotropine. All right. Next we have methylxanthine. So methylxanthine include theophylline, diprophyllene, aminophylline, and tamifylline. And leukotriene antagonists include montelukast and zafirlukast. Okay. So this is the entire classification of bronchodilators. Now if you move ahead and understand the mechanism of action of various drugs. Okay. So mechanism of action, first we understand with respect to adrenergic agonists or sympathomimetics. Okay. So adrenergic agonist sympathomimetic causes bronchodilation by the activation of beta 2 adrenoceptor found in the respiratory tract. Okay. So